Hi everyone, it's me again, Dr. Kristen John, and I'm really pleased to be here once again to present in collaboration with the Ask the Doctor series on Back to Life. I hope you got the pun. We're going to be talking about back today, managing your back pain, that is. I am Dr. Kristen John, a registered physical therapist, and I love all things aquatic therapy. But what I did my doctorate in physical therapy on was musculoskeletal management. So I'm really pleased today to be here just to really allow you with some self-management tips and strategies to better manage that annoying lower back pain that most of us have experienced within our lifetime. So what is back pain? It's basically self-explanatory, but it's pain along the spinal column or the spine with or without nerve pain. And sometimes it can radiate, or meaning it can go down like this electricity rush. It's not comfortable. If those of us who know what I'm talking about, that goes straight down the back of your legs into your toes. Sometimes it can stop right in the buttock region. Now there are different types. Okay, you could have acute back pain, which is when it's sort of fresh off the market. You could have subacute back pain, which is when it's happening for a couple of weeks well, and you could have chronic back pain when it's like, oh my God, it's been happening for ages. And basically, based on the time frame in which you have this back pain, then that's going to be dependent on what type of treatment that you receive. Okay. Note to self also that our spine literally comes from the base of our skull straight down to our buttock area, right? The coccyx. And pain could occur anywhere along that region. So yes, low back pain is very common, but it's not rare or abnormal for it to occur in the middle portion of our back or the upper portion of our back. It just depends on the part of the spinal column that was affected. So what I have here, most of us probably have seen it before, whether it's in the movies or we've actually had an MRI done. All right. So this is an MRI of that neck region into the upper aspect of our back. Okay. Now, as you can see here, there are so many different structures that work together like a wonderful family to be able to support us. I want you to understand that the back is a really resilient structure. I mean, it carries us for years, some of us over 70 years, okay? So of course it's not abnormal or weird, or we shouldn't be too alarmed when we do experience some sort of aches and pains and strains in this region. There are many different structures that help to support the back, such as muscles, and it's not always just those muscles around the back. I mean, did you know that a weak bladder muscles can affect lower back pain? That's just to give you an idea as to how interconnected the body is, and as to how many different type of muscles that sometimes not even close to the spine all work together to improve your spine health. Then you also have ligaments and tendons and disc, and all of these are part. You don't need to know, we don't have to go into all of what each of the support structures do, but do understand that they work together in cohesion so that your spine will continue to support you and to allow you to move and do those activities that are important to your daily living. So what are some of the triggers of back pain? Now, there are two major types, mechanical back pain and non-mechanical back pain. So mechanical back pain is as a result of things such as poor posture, or let's say you got into a car accident and had some sort of traumatic injury. Non-mechanical would be something like, I'm feeling so stressed out, and because your body is so interconnected in that mind-body connection, that stress response causes your muscles to bind up and get tighter. And the tighter the muscles, it affects how the spine works, and sometimes that could present itself into lower back pain. Smoking also increases your odds of having lower back pain, and also some illnesses. Now, there are some illnesses that would show up. We call it like referred pain. So for example, it's very common for my patients to come and do a first assessment with me, and I spend a whole lot of time really ruling out that there's no kidney disease, there's no cancer, there's no other symptoms that may be causing this back pain, because sometimes back pain could be a symptom of something really serious if we can't really figure out, what is the mechanical cause of it. So it's not just, oh, I have this pain, this lingering pain in my back for months, but I hear back pain is normal, so I'm going to move on. No, you should definitely check it out with your physician, okay, or healthcare provider. All right, so the meat of the matter, self-management strategies. Now, back pain affects over 80% of persons in the globe. I mean, it doesn't care about your race. It usually affects those in the older age group, but now because we are seeing children spending so much time in sitting and slumped over positions with texting or video games, we're seeing it happening in even an earlier age group. So it affects basically all walks of life, but your chances improve or increase, I should say improve, increase as you get a lot older. All right. So the number one recommendation, once your healthcare professional has ascertained that the reason for your back pain is as a result of a mechanical cause that is safe for us to intervene and treat, is therapeutic exercises. There are so many different type of exercises that your healthcare professional, especially a physiotherapist, are trained to improve, whether it's working on your posture. There's some very tiny muscles that many people overlook called your lumbar stabilizers, your breathing muscles, your pelvic floor muscles, or those muscles that help with supporting and pass stool. All these are really important to the package of improving your back health. So sometimes, I know we love Google. I mean, I use it too. We say, hey, let's just Google some quick exercises for back pain. But I would really recommend, and yes, I am biased, that you really sign up to see your physician or a physical therapist when it comes to that nagging back pain, because we are going to be able to customize that exercise program based on how you're presenting. I mean, think of it like this. If you can afford to purchase a customized wedding suit versus going to a store and probably just buying a generic one, wouldn't that customized fit give you a much better look or a much better outcome? It's the same thing with getting involved with your physical therapist. They're able to customize your back pain program, and you are able to share your goals and you work together to achieving this, okay? Now, something that's also overlooked, and especially now that there's a lot more remote work happening globally, is to reevaluate your workspace. Many persons in a very small space of time had to make little tiny offices in their home, and we all want the Instagram-like background, and we probably on an ironing board there with a little LED light with a selfie ring, but really and truly we're pretty uncomfortable where we're sitting. Look at your chair. Look at your position of your eyes to your cameras. Look at where your hands are in space. Do you have that 90-degree angle? I mean, your keypad, literally, or your laptop should be at 90 degrees. And there's so much information that you could actually find online as to what is optimal sit-in work ergonomics, okay? And all this can make a difference. Now, a lot of times we tie this information into adults, but I want to beg to differ, since a lot more kids have been doing online schooling. This also applies for your children, okay? Ensure that where they are doing their schoolwork is very comfortable so they don't increase their chances for back and neck pains and stress and strains, okay? Sometimes it's as simple as making that change. Also, your mattress, after a certain amount of time, your mattress needs to be changed. And also, if you observe that you're having persistent back pain, perhaps your mattress is not supporting you enough. Now, you would have heard me mention before in the presentation, a mind-body connection. I cannot tell you the amount of times I could tell from simply touching my back pain patient that they are stressed. Sometimes you don't need us. Sometimes you need to speak to a mental health therapist because there's so much stress and your body picks that up. So you get super tight in your upper traps or your upper muscles, and your back muscles get really tight. Yes, we do a wonderful job releasing it using manual therapy, but sometimes it's a little bigger than us. But still see your healthcare provider, because many times we are really great at referring for outside help when we see the need for it. Most of us work in jobs where, we sit for a prolonged period of the day. I am here to ask you to minimize that. We should be changing our positions every 10 minutes. I know sometimes you have that document that you have to hand in, but could you probably stand and type? Or could you probably just walk around your desk a couple of times? It does make a difference. And the research also shows that it improves your life expectancy. Yeah, how long you're going to live, simply by how long you sit. Another thing you must do is lift and rest well. Okay, now I want you to look at the lady that is in the diagram with the red top on. You see that when she's about to lift the box, even if it's just some feathers in it, that she pulls that box very close to her body. She bends slightly through the knee and she lifts up into an upward position. Even sometimes as new moms like myself, I want you to know that even the way you lift that child out of the crib, tighten your tummy and bring that child closer to you, okay? So that you minimize the stress and the strains on your back. When you are changing the child, see if you could have a change table that is going to be at chest height, so that is going to avoid you from bending over too much to change the child's diapers. How you sleep matters is more than the mattress. Now, I want you to see that the lady that is highlighted in the yellow part of this slide, that there is a pillow below her head and her knees for optimal resting positions. Please avoid sleeping on your tummy. I know it feels good, but your back hates it. Your back loves you lying on your side or lying on your back, but do use pillows to help support other structures. Now, as I said, back pain is not just, oh, everybody has it. There are some serious implications. I want you to do me a favor. If you or your loved one has difficulty peeing, pain that is made worse by sneezing, coughing, or peeing, or you have chest pain, call 911. Call 911 immediately. It may be something a bit more concerning, and you need your physicians to rule it out. But when it's all said and done, I want you to remember your back is strong. Your back can heal. Doesn't matter if it's years or chronic pain. And movement helps the healing process. Inactivity actually delays it. So not because you have back pain means you can't move. Move. Activity helps. So that brings us to the end of today's presentation. I just want to also inform you that on www.kristinjohnphysio.com, we have a lovely blog post of some aquatic therapy exercises you can do for those of us who love to exercise in water or want to try exercising in water. Do have a good one. Bye.